So you delivered vaginally, and now you have to heal from the vaginal delivery. And for some people, that's not a total piece of cake. If you had a bad tear or you had an episiotomy, it can be pretty tender and painful down there. Even if you didn't tear, it can get swollen and be tender. I always tell patients that ice is your friend, and ice, especially at the very beginning, can be really soothing. There are some other things, witch hazel and Tux pads are medications that you can put on the vaginal area that can be quite soothing. The best thing to do really though is to leave it alone and let it heal. The vagina actually is very forgiving and it heals very well, and usually by 6 weeks you can't even tell that there was a tear or there was an episiotomy. So you can look forward to sort of getting back to normal. The other thing that you can do is soak. Soaking can feel really good. So if you have a tub, you can soak, something that we call a sitz bath, and they can teach you about that in the hospital. But basically soaking can be another good thing. One of the good things is that it's very, very rare for an episiotomy or a vaginal tear to get infected. In fact, I can't even remember ever seeing one get infected. That's how rare it is. So at least that's something that you don't have to worry about. The other thing you're going to find is that wiping after going to the bathroom can be very painful. And so the hospital will usually give you a little squirt bottle that you can use to rinse yourself off rather than wipe, and that will be, I think, a lot more comfortable for you. The other thing that I tell my patients is that the vagina is not to be used for 6 weeks. So you really should not have sex for 6 weeks after having the baby. Number one, you want to let the vagina heal, and also you want to let the cervix close. So that's pretty important as well. But you will find that things will get back to normal. Now, the other thing that you're going to find, even at 6 weeks, and your doctor says you can return to having sexual relations, it may still be tender for a while. Don't be surprised. Believe me, eventually it will get back to normal. But the body, even though 6 weeks is sort of the mark we use, the body really doesn't go completely back to normal right away. And your hormones still are changing and getting back to normal, which really affects the vaginal tissue. But don't worry, everything will go back to normal eventually.